Hey guys, Dr. Rick coming at you with another video. Today we're talking about the hip hinge, specifically what it is, how to apply it, and how to strengthen it. Whether you deal with low back pain on a daily basis or if you're a professional athlete, everyone hip hinges every single day. So learning how to do it properly could be the difference between that daily low back pain or improving your vertical by 2 inches. So if you think this applies to you, I hope you guys can take away some of these strategies. For the average person, picking something up off the ground may look something like this. Although that looked fairly normal, for anyone with mild to moderate low back pain, it could have been enough to actually irritate their low back. Yes, I bent at the knees, and I did hinge at the hips, but I also flexed in the low back. And when you flex in the low back, even with gravity alone, it's enough to create some shear forces, which could irritate the discs and strain posterior elements. Not only that, when you flex in the lumbar spine, you're putting the muscles that bring you back into an upright position at a disadvantage. So next, we're going to show some strategies of how to perform that task solely through hinging at the hips and keeping that lumbar spine neutral. So for exercise number 1, I want you guys to find a broom at home, unscrew that broom, and you're stuck with a dowel. So you need a broom and a wall. I want you positioning yourself about 6 inches away from the wall. And what we're going to be doing is we're going to be driving that broom at the creases of our hips right here. And as we do that, it should force the butt to shift backwards until it taps the wall. This whole time I want you keeping the spine neutral and coming back up. So from this angle here, it should look something like this. Driving the dowel into the hips shifting backwards, spine neutral, back up. And back up. So for exercise number 2, we'll be using the dowel again. And now we're going to check in to make sure we really do have that neutral spine when we're performing the hip hinge. For this, we'll be putting the dowel along our back and creating 3 points of contact. 1 is the occiput, 2 is the mid-back, and 3 is the sacrum. So as we perform the hip hinge, we're maintaining all 3 points of contact and we're not establishing any new points of contact. So hinging, keeping the spine neutral, and back up. And back up. So a strategy that I see a lot of chronic low back pain patients have is as they hinge forward, you'll see the dowel start to lift up off of the butt. And the reason for that is they've started flexing in the low back. So if everything is neutral, it should maintain that point of position and not lift off the sacrum. Now that we've learned the proper mechanics of a hip hinge, we're going to apply it. So if you're able to go through exercise number 1 and 2 with perfect form and no pain, you're ready for this. So for the first one, what we're going to have is a kettlebell, a dumbbell, anything of any weight on the ground. Again, you want to start at low weight. And we're going to put that hip hinge to use. So keeping in mind the principles we've learned, 3 points of contact and shifting the hips backwards, we're going to bend forward and pick the weight up. And we're going to come up. Some of you may think of this as a deadlift. However, it's also known as a hip hinge. This may not surprise a lot of people, but the principles of a proper hip hinge actually apply to a lot of exercises. After the deadlift, a second one is the kettlebell swing. A third one is the vertical jump. And a fourth one is an Olympic lift such as a snatch. So as you can see, the hip hinge has application in a lot of different areas. Whether you do have some low back pain or you're just that person that likes to go to the gym on a regular basis, the hip hinge applies to you. So I hope this video helps with some strategies to improve your hip hinge and hopefully improve whatever goals you have that lie around the hip hinge.